So the next question is, what am I going to look like? What do I expect to look like after surgery? That's a great question. I love this question. So one of the things I tell patients, if you don't look like Beyonce, you're not going to look like Beyonce after surgery. You know, we all have to have realistic expectations. And it's very unfortunate that patients will come in, they'll bring photographs of certain people. They will bring photographs of breasts. I would like for my breasts to look like this. First of all, you guys have different body habits, okay? You show me a patient who is 5'4", weighs 120 pounds. You are 5'6", you weigh 200 pounds, your breasts would never look like that. So what I'm trying to say is we have to have realistic expectations. I try not to overpromise and underdeliver. I underpromise and overdeliver. One of the things I tell patients is that you have to have realistic expectations. This is so much we can do. I'm not God. I can do miracles, but even the Almighty God did not make us all even. So we have to have realistic expectations. Number two, to have excellent results, you always have to be very close to the ideal weight, ideal everything. You know, I always say that the people who don't need surgery are the people who get the best results. I cannot take you from a 5'4" person, 200 pounds, and do a tummy tuck and you're gonna look like a 5'6" person who weighs 130 pounds. That is a no-no. So having realistic expectations is great, and knowing your own limitation is also great. And please don't just go by what Instagram, social media, photographs that you see on the net. Don't use that because it sets you up for disappointment at all times. A lot of people are posting photographs that are not real, they are fake, okay? They show their butt, even though they might have surgery. They are lifting their butt in another way. They are wearing clothes. All this is not realistic. And you have to know your own body and you have to know realistically what you're gonna look like. And last but not the least, make sure that you see a board certified plastic surgeon whenever you go for evaluation for body procedures, okay? There are so many surgeons out there who are calling themselves plastic surgeons, and they are not plastic surgeons. And we talked about this in our last segment. The fact that somebody advertises as a plastic surgeon does not make him a plastic surgeon. You have to ask him, point blank, are you board certified by the American Board of Plastic Surgery? That's the only board that certifies plastic surgeons to do plastic surgery.